Welcome back to Daytime, everyone. As we get older, we all have our share of aches and pains, but for some, back pain can be debilitating. Today, we're going to tell you about a minimally invasive way to take care of that pain. We have Dr. Michael Perry joining us. He is the co-founder and medical director of the Laser Spine Institute. Good to meet you, sir.
Welcome.
So let's talk about the aging population and common back problems that you're seeing.
Okay. Well, as we all age, the body deteriorates and the spine is no exception. As we all age, we can develop degenerative arthritis of the joints called facet joints. We can develop bone spurs, bulging discs, and a condition called spinal stenosis, which is very common as we all get older. Basically, spinal stenosis is a narrowing of the spinal canal to the point where you're compressing the spinal cord, and that can be very painful.
And what are the ways you can treat that?
Well, with any patient, when they have a problem with their spine, typically conservative treatment, non-surgical approach is always beneficial, meaning physical therapy, chiropractic treatment, adjustments, manipulations, medications, injections. When patients undergo conservative treatment and don't get the response they're looking for, then surgery might be an option.
Now, why is the Laser Spine Institute so unique?
Well, we do outpatient minimally invasive spine surgeries. We do more endoscopic surgeries per month than any facility in the U.S. This is all we do. All of our surgeons do nothing but spine surgery outpatient in these outpatient facilities, and we do more than anyone. We don't do knees, we don't do shoulders, we don't do hips. We just focus on the spine.
And when a patient comes to you, it's not like they just meet you the day of the surgery and then say, see you later once it's over.
No, as a matter of fact, they have a process. They come in, it's a 5-day process. Typically the first 2 days are diagnoses, testing to determine the precise location of the pain. Typically the third day is the day they have their surgical procedure. And the fourth, 5th days are rest and recuperation and post-operative care.
And what is the best way for someone to find out if they're a good candidate for this?
Well, anyone who's had a medical condition, orthopedic-related condition, where they have bone spurs, degenerative disc, spinal stenosis, and they've tried the conservative treatment, the non-surgical approach, and they're still having a problem, then they may be a candidate for what we do. And the best way would be to either call our toll-free number or our website, laserspineinstitute.com.
And what kind of surgical outcomes do you usually have?
We have great outcomes. Matter of fact, we just had an article that was published in the Journal of Orthopedics earlier this year that specifically looked at 320 patients that we followed for an average of 18 months. And these patients filled out questionnaires of pain and disability before surgery, and then they did them after surgery. And the article actually showed there's a statistical significant improvement in pain and disability on patients that underwent lumbar endoscopic spine surgery for the treatment of spinal stenosis.
And do you have a lot of people who say, I lived with this pain for years, I wish I had done this a long time ago?
If I had $1 for every time I heard that phrase, I would be independently wealthy. It is amazing. If it was that easy, I would have done it many years ago.
All right, so for more information from anyone out there who's interested in learning more about this and you want to get your MRI looked at here at the Laser Spine Institute for free, just give them a call at 1-866-208-0337, or you can go online to laserspineinstitute.com for more information. Dr. Michael Perry, thank you very much for inviting us into the Laser Spine Institute today, and congratulations on all your success.
Thank you.
We'll be right back with more Daytime, so don't go away.